Your kidneys can be losing function for years without you knowing. And there are 7 quiet warning signs your body sends out long before any doctor catches it on a blood test. Most people ignore number 3. Welcome back to Ask Nurse Daily. Here is something most people don't realize. By the time a routine blood test catches kidney disease, your kidneys are often already running at 50 or 60% of their normal function. That's because your kidneys are remarkable. They keep cleaning your blood even when they are deeply tired. And they don't complain loudly, they whisper. Today I'm walking you through the 7 whispers I tell my patients to never dismiss. The early kidney warning signs that get brushed off as tiredness, dry skin, or just getting older. Pay close attention to number 3 because it's the one almost everyone explains away. If this kind of nurse-led health information is useful to you, hit the subscribe button. We share a new tip every Tuesday and Friday. Let's start with the most common one. Sign number 1. Persistent fatigue that no amount of sleep seems to fix. Here is what's happening inside your body. Healthy kidneys produce a hormone called erythropoietin, which signals your bone marrow to make red blood cells. Red blood cells carry oxygen, so when kidney function drops, your red blood cell count drops with it, and every cell in your body starts running on less oxygen. The result is a deep bone-level tiredness that coffee doesn't touch and a full 8 hours of sleep doesn't fix. Most people blame stress. Most people blame age, but it's one of the earliest kidney disease symptoms there is. So here is what to do today. If you've been exhausted for more than 2 or 3 weeks straight, even with good sleep, ask your doctor for a basic metabolic panel and a complete blood count. Specifically request that they check your hemoglobin and your creatinine. Both numbers tell a story. I had a patient, a 48-year-old teacher, healthy weight, exercising regularly, who told me she just felt heavy. That was the word she used, heavy. Her doctor had told her it was perimenopause. She pushed for a kidney panel anyway, stage 3 kidney disease, caught early enough to slow it down dramatically. Sign number 2, swelling. Specifically in your feet, your ankles, around your eyes when you wake up, or sometimes in your hands. Your kidneys are responsible for balancing the salt and water in your body. When they start to fail, they hold on to sodium. And where sodium goes, water follows. So fluid pools in the lowest parts of your body during the day, the feet and ankles, and around the loose tissue of your eyes overnight. People often blame the swelling on a long day, standing, on flying, on eating something salty, and sometimes that is the cause. But if it's happening regularly on most days, even when you haven't been on your feet, that's a kidney signal. Here is what to do today. Try the sock line test. At the end of an ordinary day, take off your socks and look at your ankles. If the elastic from your sock has left a deep ring that doesn't fade for 10 or 15 minutes, that is real fluid retention. Take a photo of it, show it to your doctor, ask specifically about kidney function, and a urine test for protein. One of my patients noticed her wedding ring suddenly felt tight every evening. She thought she was gaining weight. Her weight hadn't changed at all. It was kidney-related fluid retention. We caught it early. Always talk to your own healthcare provider before making changes to your diet or your medication. Sign number 3 is a change in how often or how much you urinate, especially at night. This is the whisper that gets dismissed more than any other. Healthy kidneys concentrate urine overnight so you can sleep without interruption. When function declines, you produce more dilute urine more often. The medical term is nocturia, and it's a major warning sign for adults over 40. Also watch for foamy urine that doesn't flush away easily or changes in color. Track your trips for 1 week. If you're up more than once a night consistently, ask your doctor for a urinalysis. We caught a patient's kidney disease at stage 2 just because he mentioned these night trips. Don't wait until you feel sick. This channel is for education, not medical advice. Always talk to your own healthcare provider before making changes. Sign number 4. Persistently dry, itchy skin that lotion does not help. When function drops, waste products and minerals build up. Your skin is one of the first places it shows. The itch can be all over and sometimes intense enough to wake you up scratching at night. People reach for expensive creams and oat baths. None of it works for long. The problem isn't on the skin, it's underneath. If you've been itchy for more than a month without a rash, make a note of it. Mention it to your doctor. Combined with fatigue or swelling, it tells a much bigger story. One patient tried lotions for years. Once we treated her kidneys, the itching disappeared in 3 weeks. This channel is for education, not medical advice. Always talk to your own healthcare provider before making changes. Sign number 6, getting unexpectedly short of breath, especially with activities that never used to bother you. This happens for two reasons. Anemia means your blood carries less oxygen, and when kidneys struggle, fluid can build up around your lungs. Notice if daily habits like climbing stairs or carrying groceries suddenly feel harder. Don't just shrug it off as being out of shape. A lifelong gardener I know thought he was just aging when he couldn't pull weeds without being breathless. It was actually kidney-related fluid. With treatment for his anemia and kidneys, he was back to his garden within months. If simple things feel harder than they did 6 months ago, that's a signal. Mention it to your doctor today. Finally, sign number 7. Trouble thinking clearly, brain fog, or a new difficulty concentrating. When kidneys can't filter waste, it reaches your brain. Combined with anemia limiting oxygen, it creates that foggy, slow feeling. Most people assume this is just normal aging or stress, but if it's persistent, it warrants a kidney check. A sharp accountant I treated feared she had early dementia. It was actually her kidney function. Once addressed, her clarity returned. Be honest with yourself. Write down your observations. Doctors take written notes more seriously than vague descriptions. If your thinking has changed, don't minimize it. Mention it to your doctor today. Your health is worth it. Alright, let's recap the 7 whispers your kidneys send before they fail. 1. Deep fatigue that sleep doesn't fix. 2. Swelling in your feet, ankles, or under your eyes. 3. Changes in how often you urinate, especially at night. 4. Persistent itchy skin. 5. A metallic taste or ammonia-like breath. 6. Shortness of breath with mild activity. And 7. Brain fog and trouble concentrating. If 2 of these sound like you, please don't wait. Ask your doctor for a metabolic panel and a urinalysis. These simple tests catch most early kidney problems. Now, scroll to the comments and tell me which sign surprised you most. Just type the number. I read every comment. And if this was helpful, please subscribe. It's free and helps me keep making these. New tips every Tuesday and Friday. Next Tuesday, I'm walking you through the Femper1 vitamin deficiency causing fatigue in people over 40. You will not want to miss it. Remember, this channel is for education, not medical advice. Always talk to your own healthcare provider before changing your diet, your exercise, or your medication. Take care of yourself, take care of the people you love, and I'll see you Tuesday.